The ability to read is arguably the most vital skill for facilitating school success. However, many students present with reading difficulties. Possible causes of reading difficulties may include health differences such as speech development, dyslexia, and sensory differences, behavioural or emotional issues, ineffective, incomplete instruction, high absenteeism, and a poor relationship between the teacher and student, socioeconomic status of families, and the language spoken at home. There are specific underlying areas of knowledge and skills which present challenges for children with reading differences. Word recognition challenges are evident when students do not have a broad sight word knowledge. Phonological processing challenges prevent fast and confident reading. Language and metalinguistic challenges may include poor word order or grammatical knowledge and restricted working memory. Text processing challenges happen when students are focused on the lower order thinking aspect of the text. So, what should teachers look out for in the classroom? Slow word recognition, poor spelling, difficulties with working memory, slow in completing and understanding tasks, lack of interest or avoidance of tasks, poor reading comprehension, poor knowledge of letter sound correspondence and recognition, seen when reading nonsense words and performing disfluent reading. These signs assist teachers in using their professional judgment to identify students who may have reading difficulties. Accurate teacher judgments and observations are critical in formal assessment strategies. It is important to note that we as teachers are assessing for intervention, not for diagnosis. There are also a range of assessments, including PAT-R, which assesses comprehension knowledge, vocabulary, and spelling, running records, sight word testing, phonological awareness tests. In the past, wait to fail methods were used as identification tools, such as the discrepancy model. This model defined a learning difficulty when a student's measured intelligence and their actual level of achievement were disproportionate. This needed standardized test results to show significant discrepancies, and intervention was continually delayed. Slight improvements led to reduced essential support, and there were inconsistencies between schools. Now there is the response to intervention, or RTI model. This model has 3 tiers. Tier 1 involves high-quality, inclusive teaching for all students. Teachers use their judgment to identify signs of reading difficulties as addressed previously. Tier 2 involves additional small group interventions for students who are at risk of underachievement, around 20% of students. Tier 3 involves individual targeted intervention for students requiring intensive support of persistent difficulties by a team of specialists, around 5% of students. This group are underachieving despite intervention. This tier allows teachers to refer to medical professionals for formal assessment. Early intervention, which is seen in this model, is beneficial as it enables appropriate instruction for students, facilitates higher success rates by minimalising impact of the learning difficulty, prevents the Matthew effect, where achievement will not improve without foundational skills, and it reduces emotional problems which could escalate without intervention. These include effective consequences of learning failure, which may be displayed as low self-esteem or self-efficacy, motivation, and self-worth. Research shows that successful intervention is evidence-based, appropriately paced, cumulatively sequential, systematic but repetitive, includes regular ongoing assessment. Along with intervention, a universal design for learning approach is needed to accommodate all learners. Some accommodations to reduce the impact of poor reading skills could include providing extra reading time, avoiding children reading aloud, encouraging assistive technology, making sure print is not the only source of information, enlarging print size or adding extra line spacing, and allowing extra test time so students can listen to the question rather than read. There is a debate about whether a whole language approach or a skills approach should be taken to teach reading instruction. Whole language approach involves an emphasis on purposeful reading, where students are immersed in language-rich topics with an open-ended approach, whereas a skills approach involves explicit instruction of literacy skills and a thoughtfully sequenced curriculum. Recent research now suggests that taking a balanced approach to what is taught and how it is taught is likely to produce the desired outcomes. A widely accepted view of a thorough approach to literacy teaching includes the principles of the whole language approach with explicit instruction of decoding and comprehension skills. However, it depends on achievement levels of individual children as to how much explicit instruction is needed. The RTI model assists with this assessment. Students who have significant reading difficulties will need a great deal of explicit instruction to teach the foundation of reading skills. There are also current debates about labelling learning differences, such as reading difficulties. Benefits include leading to the development of specialised teaching methods or interventions and providing a platform for professionals to communicate with each other. The disadvantages include teachers having preconceived ideas, expectations, or stereotypes about achievement levels. All students have the legal right to a high-quality, inclusive education where they become successful learners. The Australian curriculum is of high quality and provides scaffolding with flexibility in order for teachers to cater for and take into account student diversity through personalised planning and teaching. It is important to know all of your students to cater for their diverse needs so they can reap the benefits in their learning journey.